Hey, everybody, Dr. Rob Silverman here. I've got Jessica Preston, the visionary founder and CEO of De Novono Fertility. I'm excited about this topic. I think this is a topic that was not discussed enough. She's going to give you some real great insights. So, Jessica, it's a pleasure to have you. How are you doing today?
I'm doing very well. Thank you. Thank you for having me.
Oh, I'm happy that you're here. Let's just dig right in. How did you get into the field of functional fertility?
So I was, as a physician assistant, working for about 20 years in OBGYN conventionally, and I have a background in biochemistry. And I started doing functional medicine about 2015, but prior to that was always utilizing a lot of those functional medicine concepts. Then I underwent my own fertility struggles in 2004 or so, and had a big lens on my own self to say, what's going on here? Felt those same pain points that my patients were struggling with. And at that point in time, I did have the thought of this will help more people down the road. And I started delving into why, what is the cause here? How did we get here? And when you start looking at the rates of fertility issues, we're now at a rate of 20%. 1 in 5 couples can't conceive. So we needed to start making some changes.
Outstanding. I'm a big proponent of functional medicine, root cause resolution. So I love the idea that you're adding the tenets of functional medicine to fertility. In that, what are some of the things that you're doing to address the vast increase of infertility?
Right. So what we have a coaching program because what I found when I was practicing medicine for fertility, the majority of what I was doing was teaching people how to make the lifestyle changes. And we can do the testing, and some of that is very accurate, and some of it is not as accurate. But ultimately, those underlying things that we need to do, such as heal the gut, decreasing inflammation. And that's our two main things that we look at are nutrition and healing the gut. So we do anti-inflammatory diet, but we boost it up with some baby-friendly, egg and sperm-friendly nutrients, as well as supplementation. Also, in addition to that, what we do is an anti-inflammatory protocol. We also teach mindful eating because our mindset is really important when it comes to while we're eating, we need to make sure that we're not in a stress state because then our absorption of nutrients isn't going to be appropriate or adequate. And then the other thing that we do primarily is we focus on stress management and nervous system regulation. So what we've found, I have a team of 8 coaches, and the way that we approach this is we are a team. So think about your high level athlete. They don't just have a physician, they have a personal trainer, they have a physical therapist. So we have a team of 8, and all 8 of us are there for every couple so that we can really handhold them through this really devastating process. Is what people really find is number one, they can't conceive, and number two, they're isolated alone and their nervous systems are shot. So the first thing we do is we address nervous system regulation before we teach you how to eat, before we teach you how to breathe. Well, that's the beginning as well. We actually teach you how to breathe. We do heart math. We get you at a conscious, subconscious, and unconscious level so that we can just regulate your nervous system to the point where you can say, this is achievable, it's attainable, and then we can hold their hands through the process. So our team together, we are what hold that system. We have men and women, so we approach the partnership. We don't just approach mom, we have mom and dad. Everybody shows up for a short educational piece, and then we separate into mom and dad groups so that you have that support. So we have that built robust community support for them as well.
I really love what you said. Number one, doing it as a couple. So many times people have unfortunately come in my office and they point fingers.
Yes.
And sometimes the responsibility or the end result is on the woman because she obviously carries and bears the child. That said, you spoke about the idea of egg and sperm friendly nutrients.
Mm.
Do you want to share some for the male and the females, if you will? Give us some insight into your secret
Sure.
sauce.
So, well, it depends on how people present. And so we have, and what's so very interesting and so challenging when people go on Dr. Google and they try to find out what should I take, then you can say, okay, you need to take myo-inositol or I need to take CoQ10. So across the board, everybody needs to take a high quality prenatal vitamin. Everybody should be taking CoQ10. Everybody should be taking a high quality fish oil that is mercury free, that is tested, and everybody should be taking a probiotic. So across the board, that everybody, men and women alike. And so it's interesting. So we have our own supplement line. And so interestingly, our vitamins for egg and sperm are the same when it comes to our base prenatal. So it's a preconception vitamin. It's preconception complete vitamin. So it's for everybody, and everybody has to take a certain number of those. And then CoQ10, basically we need CoQ10. We're looking at electron transport chain. We're trying to make sure everything is appropriate to build up enough ATP, because we need ATP. Our highest concentrations are in our sex organs to be able to have egg and sperm health. So we want to make sure that all of those nutrients are appropriate and that they are at a certain level. Now, we aren't doing testing, we are coaching, but we do collaborate with conventional medicine and functional medicine providers in every state, so that we are a partnership, so that everybody can have their testing done if they need it. And if they don't need it, then we don't have to worry about that. We are focusing on the entire process. Now, when it comes to individuals, if we go back to the egg health or to mom, we have to look at what is the underlying issue. Do they have PCOS? Do they have, so I'm looking at estrogen dominance for people that are more functional medicine trained. I'm looking at estrogen dominant conditions, PCOS, endometriosis. Also, we're looking at, we can talk about insulin, but insulin resistance. Either way, our nutrition plan corrects for insulin resistance. So I don't worry about that in testing. But when it comes to supplements, if you are an estrogen dominant, you're going to have a completely different and almost opposing list of supplements that you'll have if you're advanced maternal age or diminished ovarian reserve. So for example, melatonin. So melatonin is something that we'll give for one camp, but not the other. So, and I hesitate to give advice here. I don't want anyone to run with it and then negate their fertility, because we can actually do harm to our own fertility if we take the wrong things based on somebody's just description on Google. But if we have a description, even a history where we know that somebody has PCOS or an estrogen dominant state, then we can confidently go in that direction for supplementation, just as we can for advanced maternal age, diminished ovarian reserve, or for people who are with IVF. They're preparing for IVF. For people that have structural issues, they may also still need to do IVF. And so they would be in a different camp, needing even additional supplementation.
Great stuff. I mean, I love the fact that you're emphasizing the gut. Gut is the epicenter of your health.
Yes.
It's where your macro and micronutrients are absorbed, speaking to what you're talking about. Obviously, these nutrients are critical for fertility. But I find most interesting is the community that you're trying to build, the coaching community. So this is interesting because it's a focus on building community to increase fertility. Do you want to talk about some of the science behind it, so people just don't think it's just a get together?
Yeah, I would love to. Actually, it's been demonstrated in study after study that community will actually decrease inflammation in measuring like salivary components of amylase to be able to see where stress levels are. So we have it demonstrated in study, not just for studies that demonstrates questionnaires saying how much stress do you actually have, but also in chemical processes in the body. And so when we follow that and we end up in community, it's not just that. So isolation can increase those unhealthy levels of chemicals in our body as well. So there's the isolation, which is one side, which makes us less healthy. And then there is community, which does the exact opposite swing of the pendulum, which gives us greater oxytocin, which then we end up with lower cortisol levels, and we end up with more support in that space with community. So we started knowing that to be true, knowing that community is so important. If you look at blue zones, the documentation is there as well. So when you look at blue zone studies, community is such an incredible part of longevity. So when we looked at that, we thought this is great, but we had no idea how incredible this was going to be when it comes to a group of people all with different levels of knowledge and understanding for each other, and actually building a trust and a support network where people become incredibly vulnerable, which we need. We need to be vulnerable in order to be able to speak appropriately and learn how to communicate better. So we have to start with the community to provide the safety. Then when we provide the safety, it allows people to join into the community in conversation. People don't necessarily start with talking, but we find people get there pretty quickly in our program. So that's great. Even the men. So that we're surprised, like day one, men start talking and sharing, which is incredible. And we do separate men and women for this part of this. We have some co-ed group time together, but not as often as we separate. But when people come in and they learn how to communicate, then their nervous system settle down and they feel safe to share. And that builds more rapport. It builds more safety in nervous system. And then it just continues to blossom and grow.
Wow, great stuff. Again, you had said about 20% of the population suffers from infertility. Why are those numbers up? What's the behind the curtain view on that?
Right. So when we look globally, it's hard to determine because a lot of the criticism out there is a lot of people are choosing not to have children now. So maybe that is having a little bit of an impact. And I believe it may be having a little bit of an impact, but I don't think as much as we think. When we look in this country in particular, part of it is it seems that people are waiting until they're a little bit older. But what we are seeing is that younger and younger people are struggling with ovulation. Ovulation is our number one issue for infertility, is that people are not ovulating as frequently or at all. And so that's even in their 20s, as opposed to historically, even in the 2000s, it was in our 30s. So that's getting younger and younger. That is definitely a piece of it. And 69%, so it's a massive amount, are these underlying low-level issues that we can't define. So they're the anovulation, but we don't quite understand. They're the biochemical processes that aren't quite nailed down. Those are the majority of our issues at this point.
So I'm going to try and get the backstory on this, the decrease in ovulation. I'll hit you with something. We'll rapid fire.
Okay.
Increased blood sugar.
Yes.
Male, female?
Both. 40. Let me just interject that 40% of fertility issues now have a male factor. It doesn't mean that they don't have a female factor, but 40% now have a male factor.
Okay. Detoxification, too many chemicals.
Yes.
Male, female?
Both BPA, any of the xenoestrogens, all of these issues where we're causing an imbalance in our own hormone levels.
Well, you mentioned it before, but let's go for it. Stress.
Without a doubt, yes.
Both again.
Cortisol. I mean, we see these cortisol increases, and we're trying to work on our cortisol so much of the time. I mean, stress response, if you think about it, we have a stress response and we don't even notice our stress responses anymore. Cortisol goes up, testosterone goes down, cortisol goes up, progesterone goes down. So if we don't have enough testosterone, then we're not having appropriate sperm production. We're not having good morphology and motility. We're not seeing any of that. And that is a dramatic change. Also decreases in libido. So stress can cause an increase in cortisol, decrease in testosterone, decrease libido, or stress is just causing a decreased libido. We don't even have to have the biochemical response in order to have the decrease in libido. So when we see all of those factors come together, it's pretty dramatic. The other part about stress is we are very well aware with our fight or flight. What happens is we're supposed to have that response, and then we're supposed to get back into our parasympathetic. And so we're supposed to live in parasympathetic, but we don't anymore. We tend to live in our sympathetic. So the people that I'm listening to a lot are the people that are saying, I don't have any stress. And this is a big warning. I don't have any stress. I feel just fine. Anything can come my way. Anything can come my way, and I take it like a champ. I have no stress response. You are now telling me that you are only a stress response. You're telling me you never live in parasympathetic because you're not even able to identify the ups and downs of a stress response now.
So that's fascinating. That gets my chiropractic portion of my brain thinking. And when you're talking about in a stress response the whole time and wanting to get, or you're being in a sympathetic response, you want to get a more parasympathetic response to balance the autonomic nervous system and make the body more harmonious. I'm thinking vagus nerve stimulation, which is the captain of the parasympathetic nervous system, the rest and digest, wine and dine. So now we're really looking at circuitry, and this is getting really exciting. In addition to that, I'm going to do that rapid fire again. Body
Yeah.
composition, but we'll talk body composition for females specifically.
Yes, central obesity, most definitely.
And my
And too
understanding,
skinny. Yeah. And when they're too skinny.
so both ends of the spectrum, if you will. Unfortunately, 75% of Americans are overweight or obese. I guess that plays a contributory factor in infertility.
Yes, it does. And the other part, especially when we're talking about women that do have more middle, when there's more weight around the middle, is inflammation, inflammatory fat. And how are we going to, we don't want to just think about baby, because having the baby sounds a little different, but having the baby is the easy part. The rest of it is, how are you going to maintain your own health while you're raising a healthy baby? How are we going to maintain a healthy household? How are we going to maintain a nice, safe space where there's consistent love and abundance when we are really juggling the inflammatory balance, because it doesn't come without issue. So getting rid of some of that in order to get a healthier body, to have a healthier baby, has such a positive impact on the outcome for your baby down the road and for you.
Now, I know that you work with a lot of physicians, so they're taking a lot of blood markers.
Yeah,
What percentage of the, again, I'm going to talk about females, not that I'm picking on them, but
sure.
let's talk about the females because women have a higher incidence of autoimmunity. What percentage of the people that are having infertility that you've seen have autoimmunity as well? You know, the inability for people to balance inflammation and the body begins to attack itself, therefore almost like a spontaneous abortion, etc.
Sure. So yeah, I would say clinically about 20%. I would say
Mm.
subclinically more like 35. So people that are, because I have a lot of conventional medicine that looks at different levels. And so I think that we see that to be a little bit higher in the way that we're looking at it. And if you don't have an autoimmunity that is defined in your history that you tell me, if you tell me about food intolerances or how you sleep or the stressors in your life, we're also looking at what is going to be your trajectory downstream if we aren't taking care of this now. So if it's subclinical, I do see I've seen more people that have had miscarriages than I expected. When we started this, I thought we would see people that had never conceived, but we are seeing people who have had more miscarriages. And that also tells me a bit about stress on your body. I think that our body will tell us whether it's safe or not to be able to maintain a pregnancy. And I'm not saying that for all pregnancies or for all miscarriages at all. There are so many reasons for losses. But at the same time, if I see someone who has had a loss and another one and another one, the first thing I want to know is, how safe do you feel your body is at a conscious and subconscious level?
Now, you talked about dealing with inflammation. I guess you also meant inflammation, autoimmunity, and the
Mm.
whole trajectory down that unfortunate road. But you've also talked about stress and conception. Now, some people say if you relax and just chill out, you're going to get pregnant. It's going to happen. So, you want to tell me if there's any truth to that or not?
Yes, I'd love to. And the horrible part of this is, yes, there is. And being somebody with fertility struggles historically myself, it makes us want to kick someone in the teeth if we hear it. That's not what we want to hear. If you just relax, we'll be fine. Uh, but when we are in a space of not being able to conceive, our nervous system gets a little, we get in trouble. We are in that fight or flight. We have that fear space. It's always in our mind, whether it's in the front of our mind, the back of our mind, it doesn't matter. So many aspects of that. It can be, I don't know what's wrong with my body. Why can't it happen to me? It can be fear because I'm not having the family that I wanted to have. It can be shame because now I can't provide a child for my spouse. There are so many aspects of that that just keep on riding and they stay steady. And when that happens, I mean, I'm a big polyvagal person, also polyvagal theory person, and also when it comes to a stress response such as that, and our cortisol will rise. If you simply think of cortisol, to make it simple, cortisol rises, as we said, testosterone decreases, progesterone decreases. We feel more stress, and cortisol is adaptive. But at the same time, when it comes to cortisol, we feel more stress because that's what our response was supposed to be evolutionarily. Your cortisol goes up, and so it's run from the saber-toothed tiger, right? But we're supposed to have it come down, and it doesn't. So when it stays consistently elevated, such as that, or we don't have as much of a dip in our rhythm for cortisol, then we can end up where we're not going to be making enough, or we're not. So it's both production of progesterone or increased destruction. So both of those things can happen. So then if we don't have enough progesterone, we can't maintain a pregnancy. So we have to have enough progesterone in our body to be able to maintain a pregnancy till 12 weeks when the placenta takes over production. So if we don't have that, that can lead to those multiple miscarriages in a row, but it also can inhibit the ability to conceive at all.
Stellar answer, stellar answer. So give me, viewers love lists. Give me a list of 5 foods that everybody should avoid if they're trying to get pregnant. And then give me the flip side, 5 foods you would recommend to keep you healthy or create an environment of fertility.
Okay, we get rid of gluten, we get rid of dairy. I'm going to think of what 5. So gluten, dairy, alcohol, sugar. What's a 5th one? That would be anything with colors, any artificial colors or additives. So eating whole foods is really what's important. So here's the trick. When we look, so we do a lot of basically along the lines of autoimmune paleo, which is a paleo diet. We do have meat, fish, whatever it may be. But for the first couple of weeks in our program, we do not. We remove we remove red meat. We remove eggs. Now, eggs are not in autoimmune paleo ever, but eggs are very high in choline. And we need choline in order for egg health. So we absolutely need to have that as the moms, more than the dads. Dads should too. So we are very conscientious, and we watch our people as they go through the program when we add those things back in and see what we need. So when it comes to what we should have, healthy fats, definitely, green leafy vegetables. We're rainbow people, you know, the rainbow, eat your rainbow of vegetables if you can. Limit your starchy vegetables. They can be your treat. So you can have your sweet potatoes on occasion. And I think I'm at 4. What else do I think you really should have? I'm a fan of having fish in your diet. We tend to make sure that we have a preference for having meat or fish in your plan because you need L-carnitine. If we don't have L-carnitine, and the only source of that are meat sources. So if you don't have L-carnitine that at an appropriate amount, then we're not making sufficient ATP, because L-carnitine is necessary to make ATP, which is the energy of the cell, which is what we need to form all of our functions in order to conceive. So that one is important, but we do have people who say, but I've been vegan. And then we just walk through, where else can we steal it from? You know, what other complete protein sources can we find? How can we do the best that we can? Are you open to taking a supplement? It depends on whether they are if they're not eating meat because of personal reasons, or because they want to just be vegan. If it's I don't want to have any animal product whatsoever, then we have to talk about whether a supplement might be acceptable to them.
You know, I would have never thought to eat an egg to help an egg and make an egg, but it's so obvious. It's brilliant. It's absolutely brilliant. Yeah. Leaky gut. I know you know what it is. You understand the whole basis. Are you testing for it? Are you concerned about it? Its effect on infertility? What do you got on that subject matter?
Yeah, we are not testing. So in order for us, we are not testing at all. But if we are suspicious for somebody's history and talking with them and they haven't been tested, then we will find them a provider if they don't have one already to be able to get tested. But what we are doing supplement-wise, nutrition-wise, diet-wise, we are in a pretty solid shape. I would say I'm not feeling uncomfortable at all. And people know that if we feel that they need to get help elsewhere, we will refer them elsewhere to be able to get that help.
Well, it looks like you work with a lot of physicians. So OBGYNs, IVF specialists, functional medicine providers. Go through the litany.
That's pretty much it. I mean, I was very lucky. I worked for 20 years in OBGYN, and so I knew a lot of people in the field and that were local to me. And I have, good credibility in this space and met with a few IVF providers. A lot of IVF providers are also seeing the increase in fertility struggles. And they're noticing it's taking now 3 to 6 cycles for people to conceive with IVF. So it takes about $15,000 per cycle, not including medication cost. A lot of a lot of insurance companies don't cover IVF, or they cover just a little bit, but not even the medications. And now we're seeing it's taking longer and longer. And a lot of IVF clinics are now noticing that people who do a program like ours tend to conceive right away with IVF if they end up with IVF. So we do have people who work with IVF. I love collaborating with IVF specialists because they don't have the time or the bandwidth to be able to take care of what we are taking care of. They have to be up on all of the latest and greatest for IVF. So that's their job. And if that's the direction that people are going to go, which is the most common assisted reproductive technology out there right now is IVF, then we need to be able to help them. And the IVF programs bypass the egg and sperm health component. So having assistance to be able to optimize that, I would sure love to see down the road how our numbers are going to improve those IVF clinic scores.
In reference to the IVF, many of the complaints which women have is that, they're taking the injections, they're gaining a lot of weight, there's a lot of hormones, it's a struggle. Their health and bodies don't bounce back. So do you deal with the almost cataclysmic effects over duration of time that they may have?
Yeah. So what I've found in the people that I've worked with IVF, they really are truly one cycles. So it's not as much. It's not that they've done these recurrent cycles. Everybody seems to conceive right away. They end up with a lot of embryos, 20, 23 eggs at first, 10, 15 embryos. And then they have more of are we going to do another transfer? How many babies are we going to have? And that side. So people do have those issues, but when we can help them with their supplementation, help them with their lifestyle, they're not having as many of the side effects. So when you go into simply IVF, then you're not actually taking care of the nutrition piece. You're feeling terrible, so you're just going to go have a milkshake because that's what has always made me feel better, right? But that's your sugar and your dairy and all of the things. We don't do that. So when we have people going through our program, and especially the support network, because IVF is very clinical, there isn't a lot of hand holding. It's basically walking through the machine. It's a ton of procedures. It's a lot of go in, get your ultrasound, get your injections, get your medication, get your transfer, move from there, because our ultimate goal is really to have that baby. But the bottom line is you're doing a number and you're bypassing whatever that underlying issue is. So we help correct that. We are seeing that people conceive without IVF. In clinic, I was taking people who failed IVF. And this is really how I started. They were failing IVF and I said, you want to try something a little different? And they said, sure. And we would just do this and then they would conceive. And so this is how we found that this process works so incredibly well.
So you've coined a phrase that I held to the end called functional fertility.
Mm-hmm.
Love it. How'd you come about that name?
It is so natural. I'm not exactly sure. Those are the words that I chose from the very beginning. Functional medicine, when we think about that, we're looking at function of the body. We're looking at optimizing function, optimizing health. So functional fertility is perfect.
I love it. I love it. What's next? What's next for you?
Oh my goodness. We are building our cohorts. We are expanding. We have our team, which is really solid. So we're always going to have a team of 8. And so a team of 8 includes, we do heart math, we do hypnotherapy. So conscious, subconscious, unconscious. I have health coaching. We have nutritionist. My nutritionist is also a pharmacist. She also has a certification in mindful eating. Then I have 3 male coaches. One is a social worker. I have another woman we added who's a somatic coach. So we basically have a full, well-rounded team of different types of specialists. So we're going to continue building those teams so we can help more people. And we're just trying to get the word out and see how many people are going to climb on the bandwagon. We do want to start following how rapidly people conceive, and we want to follow those babies.
Outstanding. You're doing some great work. How can people get in touch with you if they want to have a conversation, get more information?
Great. So our website is denovofertility.com. And if you have any specific questions, just sign up there. You can go through, we actually have a little video on there that you can watch that shows our process so that people can really have a good idea before they feel that they want to get on a phone call with us. But all of us take the calls. So the calls that we do, free fertility connection calls. So please go ahead to that site and sign up for a call, and you will get one of us. You don't get a service, you don't get a receptionist, you get one of our 8 coaches on our team who is going to have a conversation with you to see whether or not we are the right fit for you. And we're going to go from there.
Wow. Outstanding. This has been great. I mean, I learned a whole bunch. I love the fact that you utilize the idea of functional fertility, functional medicine. You work in conjunction with medical doctors. You also allow the couple to be a couple in such a difficult time. I love the work that you do, and I'm so happy you were able to come on. Love to have you again. Thank you for taking time out of your busy day. I'm Dr. Rob Silverman. We've got Jessica Preston. Proven Health Alternatives, always yours in health.